According to recent statistics, millions of Americans are living with some form of chronic pain. Two of the most popular, lower back pain, which is the second most common reason patients visit their doctor, and chronic headaches, which affect up to 1 in 20 Americans. With people living longer than ever before, these numbers are expected to rise. The good news is that over the past decade, we've seen a growing number of medical advances in the field of interventional pain treatment.
In the last 10 years, there's been a significant advance in the ability to do cost-effective types of management of pain that research is showing is increasingly not only better for the patient in terms of less narcotic usage and faster return to work, but also that we are freeing them up to have a better quality of life. With traditional pain management, you're having a combination of physical therapy with medications, and those medications will include narcotics, anti-inflammatories, and steroids. And you're giving them to the entire body. So that means you're going to have a lot more susceptibility to systemic side effects from each of those class of drugs.
As an interventional pain specialist with Pueblo Surgery Center, Dr. Massey offers advanced interventional training and techniques to patients living with chronic pain throughout Pueblo, southern Colorado, and surrounding states. Using many different X-ray guided interventions that frequently control pain, the goal is to decrease your level of pain and suffering so you can return to your maximum level of functioning and independence.
Pueblo Surgery Center is comprised of many different specialties and surgeons that offer a lot of different types of outpatient procedures. On the interventional side, our goal is to control pain. To accomplish that, we've tried to bring to the community state-of-the-art procedures so that they don't have to drive through Pueblo up to Colorado Springs or Denver to get that kind of care. So ultimately, we want to be able to return them to work and to activities with less medication, less side effects, and let them be able to re-experience their life and have fun again.
Dr. Massey in the Pueblo Surgery Center offers patients a full menu of state-of-the-art interventional pain treatments, including epidural lysis of adhesions for scarring, epidural steroids for back pain and herniated discs, spinal cord stimulators to control chronic pain from failed back syndrome, complex regional pain syndrome, or persistent radicular symptoms, and radiofrequency rhizotomy to decrease or eliminate pain arising from degenerative facet joints within the spine.
Well, with the lysis of adhesions, what we're doing is threading a catheter directly up into the area of scarring by the disc and the nerve root. So we can put different medications there that will break up the scar tissue and reduce the inflammation. The second procedure for epidural steroids, you actually place a needle through between the bones of the spine into the epidural space and deposit the anti-inflammatory medication either this way or a transforaminal approach this way. With the spinal cord stimulators, what we are doing is threading a special electrode up into the epidural space where the perception of pain goes into the dorsal column of the spinal cord. By putting the electricity across the area that has the input, we can modify it so that it's not sent to the brain as pain. For the radiofrequency rhizotomy of the facet innervation, what you do is you place a special needle into the area that brings the nerves up to the capsule of the facet joints so that when you kill that, it doesn't send the information into the spinal cord.
With a wide range of procedures available today, more and more patients are discovering how many types of chronic and acute pain can be significantly improved.
One of my doctors recommended Dr. Massey, and this procedure he does, like the one he's doing today, it works so much better than pain pills, and it'll last me I'll be pain-free pretty much 6 to 7 months. I've had so much metal in my back from my surgeries. The scar tissue was pressing against my nerve, and what he does, he goes in there and he relieves the pressure so that I don't have any pain. We're going to the Nationals again in next week, and because of this right now, because I can barely walk right now, I would be able to walk all over and be, I would say probably 98% pain-free, and I would be able to carry my pool stick, and I'll be like that for a good 6 months at least. But it helps me to get around. It keeps me out of a wheelchair, and without this procedure, I would probably not be walking today.
For the past 8 or 9 years, I've been having pain in my back, and I've had multiple infusions, a couple of rhizotomies, and nothing really has helped. So I'm really looking forward to this. If in the next week I show a 50% improvement in my pain, then they'll go ahead and schedule me for the permanent one. So I'm praying that it works. I have horses, and I'm 57 years old, and my horse last year was 27, and he gets faster every year. And last year we won championship in barrel racing in my age group in my area. And I want to be able to do that again.
The Pueblo Surgery Center helps support a group that goes to Haiti every year. And on one of those trips, the physician surgeon that goes with me had an idea that, well, why don't we do this in our own backyard? Let's take care of our own people so that people that live in our own community and don't have the resources to travel can actually give back to the community. So we brought that idea home, all the partners and the administrators bought into it, and now we actually open our doors at least once a year and do free surgery for those people with no resources, no job, no income, no insurance, and get them back on their feet so that they can resume a more productive life. And this takes them out of the emergency rooms and out of the free clinics.
People living with chronic pain carry a heavy burden, but there is a more effective approach that can help lighten that load.
We don't want somebody to give up. If you give in to pain and you become inactive, you will get worse. And what we want you to understand is there's a lot of new interventional options that we offer that can really help control it. That will get you back to a more whole, complete, functioning life with as few medications as possible.
Restore your quality of life. Contact Dr. Massey and the Pueblo Surgery Center and possibly get back to living pain-free. For more information, go to pueblosurgery.com or call 719-544-1600.